Welcome to Pregnancy Chat and welcome to week 24 of your pregnancy. I'm Monica Healy. Today I want to talk about what's happening this week with you and baby. At week 24, your baby's topping the charts at around 8.5 to 13 inches, or about 30 centimeters, about the length of this ruler from head to toe, and 1 to 2 pounds, gaining a whopping 4 to 6 ounces each week. And what's even more amazing, she can take breaths. Practice breaths, that is. Your little one is gearing up for the big day by inhaling and exhaling the amniotic fluid, and continues to develop cells that produce surfactant, a liquid that coats the inside of the lungs and facilitates air sac inflation once she is outside the womb. Her body has started to produce white blood cells to fight infections. As internal development continues, external development is progressing quite nicely as well. You can see how she is developing in these 3D images. Her lean, soon-to-be plump body is going through even more changes. Her skin, while still translucent, is becoming more pink and opaque, and her face is almost fully formed, complete with eyelashes, eyebrows, and sprouting white hair. She still has yet to develop pigment in her hair. Also, baby's movements are becoming more restricted because baby fills up more of the inside of the uterus. By now, baby has developed a more consistent sleep pattern and daily exercise time. Instead of using your womb as a springboard, baby spends time exploring the confines of the surrounding walls. She's also starting to sense whether she or he is upside down or right side up inside the amniotic sac. That's because baby's inner ear, which controls not only hearing but balance, is now developed. Since baby can hear now, enjoy some music time together. Your growing belly is probably weighing you down these days, and it's no wonder. Your soccer ball sized uterus lies above the belly button now, and with all this added abdominal pressure, thanks to your growing bundle of joy, you may begin to notice that your navel protrudes. Some women also observe a dark line known as linea nigra running vertically up the center of your belly. Have no fear, it will lighten again once the baby is born. In addition to a few extra pounds, there are countless symptoms that you may or may not have been experiencing. Not all women nor all pregnancies are the same. Some of these symptoms are vaginal discharge, dull pain in the lower abdomen, sleepless nights, heartburn, indigestion, gas, headaches, dizziness, sensitive gums that may bleed when you're brushing your teeth, leg cramps, varicose veins, decreased snooze time, hemorrhoids, nasal congestion, and possible nosebleeds. Please drink plenty of fluids to help with these symptoms. A new symptom that you may be experiencing this week is an itchy abdomen. It's caused by your growing tummy, and the skin is stretching and it becomes dehydrated. This annoying symptom may also be experienced on your bum. If you're absolutely itching all over, please mention this to your doctor. You may also notice stretch marks beginning to develop. Oh, and did I mention less sleep? Despite a heap of symptoms, and of course the fewer hours of slumber you're getting as you toss and turn throughout the night, you still are probably feeling more energized than your first trimester. And you're probably enjoying decreased mood swings as well. Enjoy this time because the third trimester can be a little more draining. If you haven't had your glucose test done already, you might want to have it done this week. This test checks for gestational diabetes. The doctor most likely will provide you with a sugary drink known as glucola, a bit like Gatorade, but even sweeter. After swigging the sweet concoction, you'll have to wait about an hour before the blood is drawn to test how your body is processing the sugar. If for some reason the test is positive, it doesn't mean necessarily that you have gestational diabetes, but you'll go on to a more elaborate test called a glucose tolerance test. There are risks involved with gestational diabetes. If it goes unnoticed and untreated, the baby can become quite large, especially in his upper body, triggering a difficult vaginal delivery and increasing the odds of a cesarean section. And once baby is born, the baby may have low blood sugar. Unfortunately, gestational diabetes is not the only risk factor to nibble your nails over. Approximately 12% of babies are born prematurely. That's before 37 weeks. About 25% of those births are induced by the doctor due to health risks or complications. The remaining births are spontaneous and often the cause is unknown. There are, however, signs that may indicate preterm labor. Intense pain in the lower back, especially if it has not been previously experienced. Menstrual-like cramps and abdominal pain. Please don't confuse these with the practice contractions called Braxton Hicks. These are normal. Another indicator would be more than 4 painful contractions within an hour, increase in vaginal discharge, a change in your discharge, mucus-like, bloody, pinkish in color or watery, vaginal bleeding and or spotting. Should you experience any of these symptoms, call your practitioner immediately. Your doctor will probably advise you to go to the hospital. If it is preterm labor, advances in technology have made it possible to save babies as young as 24 weeks. Of course, the closer the baby is to full term, the greater the chance of survival. Here are some of my tips for this week. Schedule a glucose screening if you have not done so already. You must take this test between 24 and 28 weeks. Arrange your monthly OB appointment in which your doctor will monitor your weight and blood pressure, take a urine sample, check the fetal heartbeat and the height of the fundus, and externally feel the position of the fetus, and address any symptoms you may be experiencing. Plan a tour of your hospital's maternity ward and possibly pre-register. If you plan on taking childbirth classes, I suggest you register soon. So that's it for week 24. If you have any questions or comments, please join in the conversation in the forums at PregnancyChat.com. I can't wait to tell you what is happening during week 25. Until then, enjoy this pregnancy journey. These are the precious moments our lives are made of. I'm Monica Helian. Thanks for watching.